World Bank estimate that 1.3 billion people in the world live in poverty, and by that they mean less than $1.25 a day. So that's like 1 in 2 people in sub-Saharan Africa and over a third of the people in Southeast Asia. There are 3 main research clusters within our theme. The first cluster is health, the second is technology, and the third we define as social protection and justice. Within the health theme, we're interested in things like access to health services. We're interested in building capacity in education and research in health. Within the technology theme, we're interested in how technology, innovation and science can improve the lives of the poorest and most vulnerable in the world. And as the third theme suggests, social protection and justice, we're interested in how the bigger risks that face people in developing countries, how we can help impact on those and change those.
TIDY was conceived as part of the original Irish Aid Programme grant entitled Doctoral Training for Development in Africa. And what that particular programme did was it sought to capacity build in the higher education sector between Trinity College and 4 partner institutions. It was important to put in an enabling platform at the very beginning of the original project, and the Trinity International Development Initiative became that platform. So TIDY has several different functions. It originally took care, obviously, of all of the students, but in addition to that, it also provided cross-disciplinary dissemination and outreach activities and a number of different educational opportunities, both for students here and students outside Trinity.
One of our projects was looking at the area of disability and why people with disability don't feature more strongly in health policy in many of these low and middle income countries. And that project developed a framework for analysis of policy, and that framework has since been used to analyse the national health policy of Malawi, for example, to analyse their national research policy. We're providing tools to improve the quality of policy and improve, therefore, the health system and the delivery of healthcare.
There's a fear that there's a huge amount of capital flight from the developing world. I'm working with quite a large consortium of African economists and economists from other regions of the world as well to try and figure out this entire issue of capital flight. And the bit I'm interested in working on is tax havens and low tax environments and the costs and benefits to individual countries and clearly to companies as well.
One technology we've developed is the use of sunlight to disinfect water for small communities. And we have a system set up in a place in Kenya. What we're trying to do is come up with a more centralised system whereby a community water supply, be it from a dam or a borehole, is taken through a series of transparent pipes at the focal point of a little collector, solar collector, that intensifies the sunlight. And then as the water travels along the pipes, it's in there the right amount of time to kill the bacteria, the viruses. The reactor in the villages was done in collaboration with GOAL, the NGO.
One of our projects, which we call Nourish, which is about building a nutritional research cluster between Ireland and Uganda. This involves the School of Medicine, the School of Social Sciences and Philosophy and the School of Natural Sciences and a number of partners in Uganda. And we're interested in investigating how nutrition can impact on antiretroviral treatment of HIV/AIDS. We have a randomised controlled trial where we're looking at the impact of a nutritional information campaign, an educational campaign in terms of women locally sourcing ingredients that they can then use to create their own therapeutic food. And all of these different interventions are very sustainable, very cheap from a policy perspective, and can be easily scaled up across the whole of Uganda. We aim to provide solutions to this problem rather than just having a type of a handout mentality to aid. It's like what real interventions can be put in place to improve the outcomes and improve the lives of these most vulnerable populations.
Trinity is bringing a lot of innovation to international development. It's bringing experience of good research, but it's also bringing a new and creative thinking. Very fundamentally, and as an institution, Trinity has made a commitment to international development, to being a university of consequence on a global scale.